Hello and welcome to Diamond Care Inc. Administrative In-Service Training on Field Assessments, Restricted and Prohibited Conditions, and Plan of Operations. My name is Jenna Silva and I will be your narrator for today's training. Our training objectives: understanding field assessment requirements, identifying restricted versus prohibited conditions, implementing the plan of operations correctly, ensuring proper resident placement, and maintaining Title 22 compliance. What is a field assessment? Pre-admission evaluation of a resident's needs, required before an admission, required after a hospitalization or an ER visit, required after a change of condition, and this helps us ensure facilities can safely meet our residents' needs. Field assessment required documents. Every single assessment needs these following documents to help us better determine, along with a physical visit to the resident in their setting prior to admission to our facility, or a current resident who may be in a skilled nursing facility or a hospital. We need an updated LIC 602 physician's report. Please note that the LIC 602 has now changed from a 6-page to a 9-page assessment as of 2024. Medication list, also known as a MAR, history and physical, sometimes referred to as an H&P, hospital discharge summary, behavioral and cognitive records, home health or hospice notes. Please note that the hospital discharge summary, home health, or hospice notes are typically used for assessments of residents who may currently live in another boarding care or may reside with family. Field assessment evaluation areas. We look at all these areas to make sure a resident is a great fit for us. So we look at their physical condition. Can they get up and out of the room by themselves? Do they need assistance? Do they need a walker? Their mobility. Are they unsteady on their feet? Their skin integrity. If they have a wound that's stage 3 or 4, they're going to require additional assistance. Oxygen or medical equipment that might not be allowed in our facility. Cognitive conditions. Diamond Care does specialize in cognitive residents. However, there are some residents that still might not be appropriate for our facility. Dementia and elopement risk. Some residents, even though we are a secure perimeter, might have the physical ability to scale our fence, and so they might not be a great fit for Diamond Care. Behavioral conditions and aggressive or resistance to care. These last two are sometimes tricky because we may assess a potential client and we might catch them at a good time of a day. So if you review in the notes that patient is very aggressive, we might want to maybe visit them in the late afternoon after initial visit, early morning, just to see the difference between the two times. Administrative determination. So as a collective, administrative staff are going to decide together if a resident is appropriate. After completing the field assessment and reviewing all the required documentation, administrative staff must determine the resident's appropriateness for admission based on the Title 22 guidelines and Diamond Care's plan of operations. Appropriate for admission. Residents may be admitted when resident care needs can safely be met by our RCFE staff. Resident does not have a prohibited condition. Resident's condition is stable and predictable. Staff are trained and competent to provide the required care. And the facility has the appropriate staffing, equipment, and supervision. The resident may be admitted for dementia with supervisual needs, fall risk requiring ambulatory assistance, diabetes managed with insulin only if the resident is able to self-inject and be able to use their insulin pen with guidance, and mobility assistance with a walker or a wheelchair. Appropriate with an exception. An exception is something that is given to us by the Department of Social Services. This is when a resident has a condition that would normally be considered for a higher level of care. The residents may be admitted only or retained after DSS exemption approval has been met. So, residents requiring a restriction or a prohibited condition require an exception. There's no way around that. We cannot bring somebody back into Diamond Care. We cannot accept anybody into Diamond Care until the Department of Social Services has notified us in writing that we may readmit or admit this resident. Facility demonstrates the ability to safely manage the care needs. So this is why we have ongoing training. We must be able to show that, we've got the required skills and that we're maintaining those required skills. Physicians supports RCV placement. That's where that Physician 602 report comes in. This tells the state of California Department of Social Services that yes, the physician feels safe enough for them to come and reside with our facility. Sometimes we also may need home health or hospice oversight when the exception is required. Exception approval is received and maintained in the resident's file. And sometimes DSS may put limitations on an exception. For example, must be resolved within 6 months. So we might have a resident come in who has a Foley catheter that can self-manage the Foley catheter, but is a short-term temporary Foley catheter. We would require to have home health, but the catheter may need to be removed by the end of 6 months per the Department of Social Services part of their negotiation for us to allow that resident in our facility. Restricted condition examples. So allowed with proper oversight, require an exemption. So there are restricted and prohibited. When we talk about restricted, these are conditions that vary in the degree of need and care, and so we still would need to inform Department of Social Services, but they may allow us to have that person and they may not, depend upon their overall health condition. So for example, oxygen. If a resident is unable to put on and off their own oxygen tubing, turn on and off their own oxygen concentrator, we may not be able to accept the resident. If the resident has an oxygen parameter, let's say between 2 to 4 liters based upon a oxygenation reading, then we would not be able to admit this resident. We are not a medical care facility, and we are not able to make medical assessments. So that's one example for oxygen. PEG tube with home health. This is something that the Department of Social Services must approve, and they may come back with a condition of the exception, just like with the Foley catheter. They may say needs to be removed within 6 months. Diabetes requiring insulin. Diamond Care is not able to admit any resident who requires diabetes medication in a vial or medication that's in a pen that the resident cannot self-inject. And then we have our ostomy and Foley catheter care. This care also must be approved by the Department of Social Services, and they may come back with rules to the situation, such as resident must be able to self-manage, home health in place, and so forth. So prohibited conditions are not allowed without DSS exceptions. So stage 3 and stage 4 wounds are never allowed into diamond care without an DSS approval and a hospice agency in place. This is because stage 3 and stage 4 wounds typically require wound care every day to every other day. And under Title 22, caregiving staff are not able to perform wound care services. This includes simply placing a gauze over an open wound area. If we admit a resident that has a stage 3 or 4 wound and their wound care comes undone, you must notify the agency that we are contracted with to provide that care. You may also contact our on-call nurse, inform the administrator or the supervisor on duty. One prohibited condition that would never be allowed in diamond care is going to be ventilator support. This also includes tracheostomies and potentially some high flows. Another that would never be allowed in diamond care is our IV therapy that requires 24-hour skilled nursing, meaning the resident requires IV hydration, requires TPN, or requires IV medicine every 6 to 8 hours or a frequency along those lines. Once again, that is a skilled need, and it would have to be performed by a RN, LVN through a home health or hospice agency with DSS approval. So, appropriate for admission, administrative responsibilities. So administrative staff will review all paperwork that comes in, and we're going to submit an exception request. We're going to maintain approval documentation. We're going to monitor appropriateness, meaning if there's a change of condition with the resident, we may need to obtain an additional exception from Department of Social Services. And we need to monitor the resident's condition. If we suspect the resident is having a change of condition, sending the resident out to 911, or if on hospice, calling the hospice nurse immediately will be required. The administrative staff is also going to ensure that all staff training is current and up to date, and the competencies on the staff are in the file and they understand how to properly care for these residents. And then we're going just to ensure ongoing compliance. So all these components, we're going to look at them and review them on an ongoing basis. So requires additional services. Residents may be admitted with outside professional support. So once again, we're not a medical care facility. We are a care facility for your basic care needs. So for all our clients who are requiring Foley catheter, PEG tube, anything that is considered prohibited where we've had to get an exception from the Department of Social Services, we're going to want to make sure that they're on home health services. They're going to want to make sure that they're on hospice services, and that we have the written documentation in our hands prior to allowing that client in our facility. This can result in a civil fine, and it's not good for the facility. So when a resident is not appropriate for RCFE level of care, residents must not be admitted or retained. So this goes for our current residents as well. We may have a resident who originally came to us with a Foley catheter, and the exception stated that the catheter must be removed within 3 months. If the resident physician has not had the catheter removed by that time frame, we may need to send the resident out to a local hospital. We will have to also, prior to that, contact family to try to make arrangements to see if maybe they can take the resident to a physician, urology, have it removed in office. We have to do everything we can to stay compliant. If that does not happen, we have to notify DSS and they must be sent out immediately. Resident presents with a safety risk to others. Sometimes we get a resident and they will have a change of condition that is so violent that it cannot be controlled with redirection or proper medication underneath the guidance of the physician. In this case, the resident must go out to the nearest emergency room, family must be notified, and they must be reassessed prior to coming back into the facility. Facility cannot safely meet the resident's care needs. So for any reason, if we see anything with our residents that makes us go, we don't know what this is, we don't know how it happened, or we're extremely concerned, we must go ahead and send that resident out. Examples again of residents that we're not going to be taking no matter what, and these are going to be our ventilator dependent tracheostomy patients. Uncontrolled aggressive behaviors, requires hospital level care, and requires continuous nursing interventions. So once again, IV therapies that require ongoing drips such as hydration and TPN. Documents required, mandatory. This is a DSS rule. So administrative staff must document all admissions determinations in the resident's file, including the field assessment, the review of the 602, the needs and service plan, LIC 625, admissions description justification, meaning if we've had to submit for an exception, we need to make sure that we are very well documented in this as well. And then supporting documentation, we're going to be looking at our history and physical, our medication list, psychiatric notes, social services notes, any documentation that we feel will support our case and showing Department of Social Services that this resident can be safely cared for in our facility, or that we are, doing everything we can to bring in additional help to support this resident. Just remember, failure to have documentation and failure to report and request an exception, once again, can be a DSS citation and a compliance violations. So we've had some overhaul and look at our plan of operations, newly submitted as of February 2026. Please note, at the time of the recording of this video, which is on the 15th of February 2026, the plan of operations is still under review. Plan of operations is still very similar to the plan of operations that we have had in the past. There are some new items that have been added, and there's been a table of contents for ease of being able to find the different policies. Please take a moment when everybody has a chance and just go over the new plan op and sign a statement that you've read it, that you know that you can contact Gloria, myself, or any of the upper management staff if you have any questions. And that this is pretty much the Bible of Diamond Care. So if it's not in there and you're not sure, just call one of us, email us, ask us. But essentially everything that we should encounter when we're providing care for our residents should be in this plan of operations. Just remember, there are guidelines also in there. So for special situations such as reporting elderly abuse, financial abuse, anything like that, there are policies and procedures within the plan of operations that will help you navigate that section or that situation. Sorry. So the administrative responsibilities for the plan of operation is that we're going to ensure proper admission procedures. We're going to ensure that there's proper staffing compliance. We're going to ensure that medication compliance is being met. And we're going to ensure that incident reporting compliance is also being done in a timely manner. And we will be going over that in a separate presentation. And we're going to also ensure that our dementia safety procedures are being followed and are safely understood by all involved. Administrative monitoring duties. And so for a lot of the staff, this is something that you're not going to know that's going on, but on the upper level of things, general manager, the administrator and CEO, we're going to monitor residents' condition daily, weekly, monthly. We're going to review medication and incident reports. We're going to monthly audit files and training files and be constantly putting out new training. We're going to ensure documentation is for accuracy. So meaning that we are documenting what's happening. We are making sure that if somebody's being sent out, we're filling out those incident reports. We're also going to ensure all employees have access to the new plan of operation, have reviewed it, signed it, and acknowledge it. Ensure operation of plan of compliance. So there are so many things that go into running a care facility that we are going to just be checking in on that upper level and making sure that these needs are being met. Compliance risk. So if we don't follow our new plan of operation, if we don't follow admission and policy procedures, and most of all, if we don't follow Title 22 for RCFE in California, which our plan of operations is based upon, there will be compliance issues, violations of Title 22. So DSS will give us citations. Those citations sometimes can result in civil penalties. Sometimes it can also result in licensing revocation, meaning they're going to take your license away. We're not going to allow you to operate no more. And the biggest thing is resident safety. We want to make sure that we're doing all these things so we can keep our residents happy, safe, and safe. Training summary and administrative compliance. This training provided to administrative staff with the knowledge and procedures required to conduct field assessments, properly identify restricted and prohibited conditions, and implement the Diamond Care Inc. plan of operations in accordance with Title 22. Oops, sorry guys. Failure to follow these procedures may result in the penalties as mentioned before. And we got to remember that if we end up being shut down, everybody that we care for here at Diamond Care essentially loses their home.